Hey, it's Marcus Bondi here with our favourite sports doctor, Dr. Alvina. Hi.
Hello, hi Marcus, hi everybody.
Awesome. Hey, Dr. Alvina, thank you for joining us today. Now, what do you think we're going to discuss today?
Let's talk about elbows. How about that, elbow?
Yes, hey, crucial body part, elbow. We use it in pretty much all upper body exercises.
Yeah.
And everyone's always got problems with elbows. So, Dr. Alvina, we'd love to hear your advice and opinion on elbow treatment, injury, and training with elbows.
Yeah. Commonly talked about elbow pain, on the medial side, which is sort of the inside here. You've got all the flexor muscles coming and inserting at the medial epicondyle here. So you've got your golfer's elbow, and then on the outside, the lateral side, is all your extensor muscles where they sort of insert there at the lateral epicondyle, and that's where you get tennis elbow.
Alvina, would that be because golfer's elbow, you're curling around holding the club, and tennis elbow, you're flicking your wrist?
Yeah, that's sort of the gist of idea. But obviously, tennis players can get both as well.
Okay,
yeah,
yes.
But more like repetitive use or over usage of your flexors and not stretching them out and things, and not warming up properly, overusing them, that can cause pain on the medial side.
Okay.
So tendon injuries and things like that.
Okay. So what do you recommend for people to avoid injury?
Yeah, so to avoid injury, first of all, stretching. So a lot of static sort of stretch the flexors out, hold it for about 30 seconds to 60 seconds. And Marcus always does this, so it's amazing. He's already doing it.
Yes, thanks, Alvina.
And then the other way as well, so keeping the elbow straight and then just sort of stretch the extensors as well. And then you can always do some active range of movement thing just to warm up, and then bring the blood flow into the tendons area as well before you go and do your pull-ups or your dips and stuff like that.
And what about actually massaging in the joint? Do you recommend that?
Yeah. So like if you've got injuries already or some tendinopathy going on there, obviously you can ice it. Ice is cheap, it's free, so it's a good start.
Yes.
And then you can also massage it. So not on the bone itself, but just below where the muscle belly is. So on either side, depending if you've got golfer's or tennis elbow. So you do sort of cross frictional massage, so across across the fibers. So you can do that. And the other thing as well, the stretching is really good. So the one that we talked about before, just stretch it again for 30-60 seconds. Just because our tendons, it's longitudinal collagen fibers. So when it heals up and we just rest it and not do anything, they can heal and scar up in multi-direction.
Okay.
So if you stretch it, it sort of gives it a bit of direction to heal up. So it's a bit more similar to your anatomical growth of your tendons.
Wow. So stretching it actually sort of realigns everything and straightens how it should be.
Yeah.
Oh, thanks, Alvina. I never knew that. I never knew about the cross-directional massage in the belly of the muscle. That's fantastic advice. Thank you.
Amazing.
I think that's awesome.
And Marcus, if you don't mind, I'll just jump in here and ask you a few questions as well.
Yes, please, Dr. Alvina.
So when you're training people, say if someone's already got an injury, what would be your advice for them?
My advice would be, it's crucial to avoid pain and unnecessary pain when you're training. So I'd say if you have an elbow injury, you can still exercise so long as you stay outside the pain zone.
Yeah.
So if you're doing push-ups and it hurts at the when your arms are pulled back or forward, avoid that. But if it doesn't hurt with just a small range of movement, you can still do that. Same goes for chin-ups and pull-ups. If you have a bit of elbow pain, tendonitis, don't go where there's pain. Even if you're just doing little ones like this with no pain, that's better than doing nothing at all. And like Dr. Alvina says, always be stretching, always be massaging, cross-directional massage. I think that's great, Dr. Alvina.
And the other thing I was going to say as well, if you're trying to, get back into it and, like have you seen people doing weights and
Yes.
they're either extending or flexing it,
Yes.
depending on which side the elbow is sore.
Yes.
Go really easy with the weights. Use probably like just a can of beans or a can of corn kind of thing. Go for a maximum of 500 grams and nothing more.
Yes.
just because you don't want to aggravate it and then go back to square one with the healing process.
Oh, fantastic, Dr. Alvina. Thank you. So you can use just a can from the kitchen
Yeah,
and
yeah.
just gentle movement and stretching. And would you do that slowly or fast?
You do that slowly.
Slowly,
Yeah,
excellent.
yeah.
And in a controlled manner.
Yeah, and then make sure you slow down so you get an eccentric face as well.
Ooh, nice.
Yeah.
Excellent. Dr. Alvina, thank you so much for all your expert medical sports advice. You're the #1 sports doctor in the world, and we're so honoured to have you with us, giving us great advice to the whole team at Bondi Beach, all the trainers, everyone. Dr. Alvina, thank you.
Thank you so much, Marcus.
Yay!
Thank you. Woohoo!
And be sure to check out Dr. Alvina's YouTube channel. You can see the link in the description. Have you forgotten? I'll put it in the link.